Hi, I'm Sarah SDX, author of Don'tCookYourBowls.com, a lighthearted guide to male fertility. I've decided to travel far and wide to seek out the top experts in the field to find out what causes male infertility and, more importantly, what can be done about it. Down to Beverly Hills, California, where I'm going to meet with Dr. Werthman, urologist and surgeon to the Hollywood's rich and famous. Dr. Werthman is a board-certified urologist who specializes in azoospermia, which is a condition where men have no sperm in the ejaculate. Surprisingly, there are a great number of things that can be done both surgically and medically to improve the condition and enable these men to become fathers. I'm going to talk to Dr. Werthman a little bit about what goes into that and the success stories that he's seen with his patients. I am here with Dr. Werthman here in Beverly Hills, California. He is one of the urologists that's a surgeon to the stars in Hollywood's rich and famous and really skilled. And Dr. Werthman is very skilled at dealing with azoospermia. And this is a condition where men have no sperm in their ejaculate. Is that right?
Correct. So first off, thank you for that very kind, flattering introduction. Azoospermia is a condition that affects probably 1% of the male population, maybe a little bit more depending on the type, and that is the condition where there's no sperm in the fluid that comes out.
Well, how does that happen? What goes into that?
So there's two different types of azoospermia. We break it down into different categories because based on the category, we can figure out how to treat it. So the first is what we call obstructive azoospermia, meaning someone has a blockage, an obstruction. So sperm are being produced normally inside the testicle, but they can't get out because there's a plumbing problem. The other is called non-obstructive azoospermia, which means that there is a production problem, so the testicles aren't working correctly. And even though some sperm may be produced, there's not enough that can actually be seen in the outside world.
Wow. So let's start with obstructed plumbing problems. What can be done? I'm guessing as a surgeon, you fix some of these plumbing problems.
So plumbing is something that potentially can be corrected. And the question is what is the plumbing problem? Well, there are further ways to break this down into something that is either congenital, meaning someone was born with, versus acquired. Something like a vasectomy, which is probably the most common reason for a man to have a blockage in the plumbing, is they went in and they decided that they didn't want to have any more children and had the vas cut and blocked. And then they changed their mind later on. Something that is a condition that you could be born with is being a carrier for the cystic fibrosis gene and having something called congenital absence of the vas, whereby you're born without part of the vas deferens. So it's almost like having a vasectomy. It was just something you were born with. And as I alluded to, it's usually because someone has a mutation in one of the genes that control, or one of the genes that are responsible for cystic fibrosis. So treating the problem is easy, but you have to be aware that there could be some congenital issues with children. So going back to how we treat these things, it really depends on what the cause is. So if someone who has a vasectomy, vasectomies can be reversed microsurgically. It's a intricate operation, but they're very routine in the hands of skilled surgeons, and I happen to do a lot of these. And we have very good success rate in doing that. For someone with congenital absence of the vas, what we essentially do is we go and we take sperm out from inside the testicle, or the epididymis, which is the little organ on top of the testicle where the sperm are stored. This is a very, very minor type procedure. We do it under local in the office. But to use that sperm, the patient's wife undergoes in vitro fertilization, So we take the sperm out. A doctor known as a reproductive endocrinologist will harvest a woman's eggs, and then in the lab, one sperm is injected into each egg under a microscope to make embryos, grown out in a petri dish, and then several days later, some of the embryos are placed back inside the uterus, and hopefully the woman becomes pregnant. So this is one of the incredible miracles of our generation. So when you think about it, 25 years ago, before in vitro fertilization with ICSI, intracytoplasmic sperm injection, the portion that allows us to put the sperm directly into the egg, none of these patients with congenital absence of the vas could have babies.
Wow.
Couldn't father children. But with this technology, almost all of them can father children.
Wow, that's amazing. So you're actually able to go into the testicle with a needle and pull out sperm. How do you find them? How do you know where they are? And they're small.
They're very small. So it is possible to do it with a needle, but I personally don't like doing it with a needle because of several reasons. Number one is I can't see where I put the needle. It's blind. So if you hit a blood vessel like an artery, it bleeds, and that's a problem, number one. Number two is the needle can only extract a very, very, very tiny amount of sperm. And usually we want to get some more sperm, so the doctor who puts it into the egg has more to choose from, and then there's some left over to freeze so the man doesn't have to go through the procedure multiple times. So instead of using a needle, we make a tiny little cut, very, very tiny, and we use magnification. And then we just open up the cover of the testicle just a little tiny bit, and we remove some tissue, and then I can see exactly what I'm doing. So if there's a blood vessel there, we can cauterize it so the patient doesn't bleed. And then we can take out enough to freeze. And then we put some absorbable stitches in, and the cut is so tiny we just put a Band-Aid on it.
Okay.
So, and it's the kind of thing where you can go back to work the next day.
In the case where you have a normal production and there's just a blockage issue, how many sperm can you get from one of these aspirations?
So sometimes we can get lots of sperm, and the reason is because in this situation where someone has a blockage, sperm production is normal. So that means there's lots of sperm. You asked me earlier, how do you know where to go? How do you find them? Because they're small. Well, when someone has a blockage, anywhere you go there's going to be sperm, because sperm are being produced everywhere and in reasonably large amounts.
Okay.
So from the epididymis, we may get hundreds of thousands of sperm, maybe even sometimes in the millions of sperm.
Wow.
In a blocked epididymis. From the testicle, a little bit less. But because for IVF cycle, maybe we need 20 or 30.
Yeah.
It certainly gives us extra to try to freeze.
Right, perfect. So are there other kinds of blockages besides the vas?
Yes, so another type of what we call iatrogenic blockage, meaning caused by a doctor or by surgery, is somebody who had bilateral hernia repairs. They had groin or inguinal hernias, and both sides were fixed, usually when they were children. And they're fixed by putting in a little piece of mesh, or if it's when the patient was a child, the vas is so tiny that the surgeon might not have seen it and might have kinked off. So every now and then we'll find someone who has a history of either adult hernia repairs with mesh on both sides or pediatric hernia that have blockages. And the treatment is essentially the same. We go and we take the sperm from the testicle. There are some men who develop blockages of their ejaculatory ducts. So the vas come up inside the body and meet with a little gland called the seminal vesicles behind the prostate, and then they form a little Y connection that runs through the prostate through a very, very tiny channel, about 1 millimeter wide. And sometimes a prostate infection or a cyst in the prostate at these ducts can cause a blockage on both sides. And that can either be treated, once again, by taking sperm out because they're there in the testicle, or sometimes by unroofing or cutting into that area that's scarred and opening it back up.
I see. Is there a way for you to be able to easily identify these other kind of blockages? Are there diagnostic techniques to find them?
So there are. Sometimes they're easy, sometimes they're not. So for someone who has absence of the vas, it's pretty easy because all you have to do is examine the patient. And when you examine them and you can't feel the vas or you can't feel part of the epididymis, you have the diagnosis. So I know a lot of doctors then order ultrasounds or transrectal ultrasound, which is a little bit invasive and wouldn't exactly be something that I would want to get unless I needed it as a patient. Whereas you don't need to do any of these tests as long as you have an exam where there's no vas that's felt.
Right.
You know, so an abnormality on the exam shouldn't trigger getting more tests like ultrasounds.
Right.
It should give you the diagnosis.
You don't want to take it off the tailpipe because you don't have to.
You took the words out of my mouth.
Yeah, I got it.
You should write for Hallmark.
Yeah.
Very sentimental.
Yeah, that was right from the heart.
Yes. So absolutely. And that's kind of important. I see a lot of guys who come in and they've had these big workups and they're not so comfortable and they spend a lot of money and they really didn't need it. All someone needed to do was examine them and say, hey, you know what? I didn't feel a vas. This is what you have.
Right,
you know, let's go get some sperm and spend the money actually doing something worthwhile, which is taking the sperm out because you can use it. We don't have to do huge amounts of diagnostic tests in these patients. You know, focus on actually giving them something that's worthwhile, treating the patient as opposed to just diagnosing them.
Right. Are the ultrasounds useful for smaller blockages?
So the ultrasound for the testicles isn't really useful so much for a blockage outside of if someone had an infection of their epididymis and their epididymis may be enlarged.
Okay.
But the ultrasound isn't really very sensitive in being able to resolve small blockages.
Okay.
Where the transrectal ultrasound becomes valuable is if you suspect somebody has a blockage in their prostate.
Okay.
And usually the key to suspecting that is that the volume that comes out on the sperm test is very, very low. So if only one tiny little drop comes out, kind of thing, then I have to suspect, oh, maybe the blockage is in the prostate, and the reason is that about 95% of the fluid that comes out comes from the seminal vesicles and comes from the prostate. So if that fluid is very, very low, then maybe the blockage is all the way up by the prostate.
Oh, okay. So it's also looking at the seminal volume and
exactly
really seeing putting a whole picture together.
Exactly.
And then maybe it's worth exploring
and
an
then,
ultrasound.
And then maybe it's worth doing it.
All right.
But you have to, you can't just do these tests knee-jerk.
Right.
You know, reflexively, you have to know the patient, know the patient's history, and take the non-invasive tests and put together a picture. Remember, as doctors, we're really medical detectives.
Mm-hmm.
You know, someone comes in with a problem, and our job is to solve the mystery as to what the problem is, why they have it, and how best to treat it.
Hey, I had a great chat with Dr. Werthman and we talked about all kinds of causes about azoospermia. So I decided to break it up into a couple of segments so we could take time to cover each one. Today we really went into depth on plumbing problems or obstructive azoospermia. Dr. Werthman highlighted a number of the major causes, including being a cystic fibrosis carrier, having hernia repairs, or infections. Many of these causes can be diagnosed by a skilled urologist who can do a physical exam, look at your semen analysis results, and take your medical history, and that should give them a pretty good idea to suspect a blockage. They may need to do additional techniques to confirm that. And then, you know, based on what's going on, there are quite a number of treatments, options, sperm aspiration being one of the more common ones to be able to go in and retrieve sperm, but sometimes antibiotics or other corrective surgeries will do the trick. I wanted to thank Dr. Werthman for taking time with us. I've included his information below. He's agreed to follow up with questions or emails that you might have. I also, if you're in the LA area, he's an incredibly skilled surgeon and very studied on all sorts of causes of male fertility, so I wouldn't hesitate to recommend him, and so go ahead and look him up. Also, if you're looking for more information, you can check out our website at www.don'tcookyourballs.com. We have a wealth of information about azoospermia and all other topics related to male fertility. I've included that website below. Thanks for tuning in, and I look forward to seeing you next time.